What is the connection between flossing and stroke? Flossing prevents the buildup of bacteria that form when food particles remain between teeth. These bacteria can enter the brain or bloodstream and cause inflammation in blood vessels. Preliminary results from a study suggest that using dental floss can reduce the risk of stroke. According to Health, a stroke occurs when blood flow to the brain is blocked by a clot, or when sudden bleeding occurs in the brain. William Schutze, a vascular surgeon and specialist, states that a new study shows that an affordable and easy habit like flossing may help prevent blood clot formation and reduce the risk of stroke. Suvik Sen, a neurologist and chair of the Department of Neurology at Prisma Health Richland Hospital and the University of South Carolina School of Medicine, who is the lead author of the study, says, due to the global prevalence of oral infections, researchers decided to examine the relationship between oral hygiene habits such as flossing, brushing, and dental visits and the risk of stroke. According to the World Health Organization, nearly 3.5 billion people worldwide struggle with oral diseases. In this study, scientists extracted data from over 6,000 participants. Participants provided information about their flossing habits, brushing habits, blood pressure, blood sugar, cholesterol, smoking habits, body mass index, education level, and dental visits. After 25 years, 434 participants experienced a stroke. Of these, 147 cases were due to large clots in the brain's arteries. 97 cases resulted from clots formed in the heart, and 95 cases were caused by blockages in small blood vessels in the brain. Additionally, 1,291 participants developed atrial fibrillation, AFib, a type of heart rhythm disorder that causes rapid and irregular heartbeat. Based on this data, researchers found that flossing was associated with a 12% reduction in the risk of atrial fibrillation, AFib. Flossing was also linked to a 22% reduction in the risk of ischemic stroke, when a blood clot blocks blood flow to the brain, and a 44% reduction in the risk of cardioembolic stroke when the clot originates in the heart. These associations were independent of regular brushing and routine dental visits. While flossing just once a week was still associated with a reduced risk of stroke, the study showed that the more frequently flossing was practiced, the greater the reduction in stroke risk. Schutze explained that the reason flossing may reduce stroke risk is that it prevents the buildup of bacteria that form when food particles remain between teeth. These bacteria can enter the brain or bloodstream and cause inflammation in blood vessels, potentially leading to blood clot formation. These bacteria can also cause chronic inflammation associated with gum disease, a condition linked to poor cardiovascular health. These conditions increase the risk of sudden vascular problems, stroke, and even heart attacks. The American Academy for the Prevention, Diagnosis, and Treatment of Gum Diseases recommends using traditional floss along with a water flosser or oral irrigator. Research suggests that flossing before brushing is more effective. Experts recommend brushing at least twice a day with fluoride toothpaste, spending about 2 minutes each time. Make sure to clean all surfaces of the teeth, especially the gum line where plaque tends to accumulate. Use a soft bristled toothbrush to avoid damaging tooth enamel and irritating the gums.